Stand-time report number 33-16. Discussion. Representative McDermott.
Mr. Speaker, I'd like to cast a no vote, please.
No vote? No vote. So ordered. Thank you very much. Representative Ward.
Speaker, a no vote and a brief comment.
No vote. In opposition, please proceed.
Yes. This is a health care bill that really intrudes government into the private sector. Essentially, it says if you're going to sell medical equipment, you have got to do a Mother May I and be licensed, as my colleague just said, for $300 just to sell medical equipment. You've got to have your telephone system available at a certain time of the day. You've got to have a suggestion box and a way of complaint. Mr. Speaker, this looks to be overburdensome. And by the way, for the authors of the bill on page 5, there's a grammatical error that doesn't make sense. So, Mr. Speaker, the solution to all of these things, and it's a long and tried solution, it's called competition. When people are not delivering what you want, somebody else is going to do it quicker, better, and cheaper. And instead of coming to the legislature and complaining and making a bill to where we insert ourselves into the business now of health care, tomorrow it's going to be, well, we want you to be able to have your restaurants in Waikiki serve a particular food, which because of certain ethnic or religious groups you're not serving, therefore you will serve it. This has gone for the last 8 or 10 years to the extreme, and now we're jumping on that bandwagon, Mr. Speaker. Competition is the solution, not telling these guys to be on the telephone at a certain time of day, or not saying that there's certain ways that you're going to conduct your business. Let the private sector be the private sector. Let us be government and be the referee, not down on the playing field. Thank you, sir.
Thank you very much, Representative. Further discussion, members. Representative McKelvey.
Thank you. In support, Mr. Speaker.
Support, please proceed.
This bill has been drafted because of a federal mandate under the ACA, which says you have to buy durable medical equipment at the lowest price possible, no matter the location, which is great if you live in the mainland, Mr. Speaker, and you have access to markets and delivery systems and trucking. But when you're in Hawaii, you now are dependent upon a company that's going to be able to ship on time and get the products to the very people who need it, many of our seniors and those in hospitals who need it. The reason why this bill is introduced, Mr. Speaker, is because these companies are falling short. Equipment is not showing up. Telephone hours, they're calling, they're not answering. Now somebody who needs this equipment to get out of the hospital doesn't have it. And that's why this bill is introduced, is to try to find a way so that if we're forced to do the ACA competitive bidding, that we have the ability to make sure that the products that our seniors and others need are actually delivered. So that's why I'm in support of the bill. Thank you very much, Mr.
Thank you very much, Representative. Any further discussion, members?
Speaker.
Representative Ward, second time, still in opposition.
Yes, Speaker, I want to thank the Chair of Consumer Protection for adding that footnote and actually reinforcing the fact for those of us who think Obamacare is not successful, this is exactly the reason why it's not successful, because the way it's carrying itself in this part of inserting itself into the private marketplace. If there's nobody to, even Amazon can get here in a day or two. If there's nobody out there in the private sector on the mainland who can't service us, that means the whole private sector is lacking. And ACA is not the solution to the private sector of the United States of America. Thank you, Speaker.
Thank you very much. Further discussion?